This podcast represents my opinion and the opinion of my guests. This is not medical advice, and I am not establishing a patient-physician relationship with any listener. The content here should not be taken as medical advice. Content here is for informational purposes only. And because each patient is so unique, please consult your healthcare professional for any medical questions you may have.
Welcome, everybody. It's producer Seth here again with Dr. Tadros, Dr. Chucky T. If you remember from last week, that fun little nickname we came up for you for when you finally get your rap career launched. So real quick, Doctor, how you doing today?
Good morning. Fine, Seth. A gorgeous day outside.
It is nice.
Beautiful St. Louis.
I wouldn't want to be anywhere else, really. But so I notice when I'm out in public, a lot of us, we see parents, we see them with their children, or we just see the actions of a lot of children, right? And whether it's good, whether it's bad, whether it's a negative, whether the child's achieving something, whether the child is doing something wrong, we always point to the parents, don't we?
Yeah.
That seems to be the common thing.
Certainly, the parents are nearby, or we know that they have parents. So, we kind of start thinking that way. Sure.
Awesome. So we're basically going to dive into something I know nothing about, but you know a ton about, parenting.
I have a couple of grown kids. That does not make me, I don't speak for all dads who have two daughters or anybody else for that matter. But yes, as a physician, I see some of the product and some of the repercussions of childhood actions and activities. And so we're going to talk a little bit about that. And I'll try to make a link from what I've seen for many decades now to kind of mental health, essentially physical health and mental health especially.
Okay, well, just dive in.
Well, so I started a blog several years ago, partly because I retired and partly because my kids were growing and grown, and I didn't have a chance to tell them everything I ever learned in life. So nobody ever wants to hear what their parents or grandparents ever, all of our lessons. But also I was also repeating myself to patients. Either the same patient, I would repeat the same advice or same insights, or different patients, of course, have similar problems. So in mental health, because we run a ketamine clinic, and I'm still have my primary training as an internist, but I've been doing a lot of mental health ever since I was in primary care, and especially the last 7 years as part of the ketamine clinic, as a founder of the ketamine clinic. What I see over and over again, is sometimes decades later, is people talking about their childhood. And developmental and pediatric and adolescent psychiatrists know this already too well, and I would argue all adult psychiatrists have to know this. But we should talk more about what happened in people's past, not to linger, not to blame, not to wallow, but to kind of understand, to name, to understand. And a lot of stuff that happens in childhood, both positive and perceived negative. It could be real negative that the rest of us would agree would be negative, or perceived by the youngster as negative. I hear about and affects the patient decades later, still affecting the patient, the client decades later, and that's what we end up seeing. That's what we end up trying to treat and referring people for talk therapy and trauma recovery therapy. And so that's what I'd like to talk about. I wrote a few paragraph blog back in February 24th of 2023. And I'll read it out loud, another kickoff to kind of this topic. This is, once again, not to blame, not to shame, not to anger anybody, but it's also to point out recurring themes, and it makes me think about the stuff that I did or didn't do as a young parent. Now my kids are almost 30 and 28 right now, both married. But I fortunately had a partner, my wife, Julie, who kind of balanced me out and taught me a lot of stuff. Even as a young physician and as a young dad, I had a lot to learn, and I'm still learning. And that's why we look forward to having people talk, discuss, send us emails, and kind of comment. It's titled Kids. I grew up with my parents and my brothers around me all the time. There was love. At times, that love revolved around right words and right actions, occasionally with a parent making harsh corrections. The older I get and the more adolescents and adults that I see for their mental health concerns, the more I recognize that kids need loving, predictable, and stable boundaries. Kids need to learn by frequent, excellent examples. They need to learn by witnessing how things are said, what things are said, discussed, and how things are done, how people behave, and how good people, treat each other. Kids are exceptionally good imitators. They want to do good work. They want to show off their good work and accomplishments. They want to become independent, competent, and confident. They want to be, at the very least, noticed for who they are and for their competencies and accomplishments. Compliments from people who matter in kids' lives are not just superfluous bonuses. Compliments augment these kids' internal drives to persist and to achieve more. Kids want and need your attention and your encouragement. In contrast, corrections, reprimands, demerits, tongue lashings, public or private shaming, corporal punishment, and corrective action plans are demoralizing at their worst, work temporarily, or create traumatic defensive behaviors, and are dehumanizing. So I woke up one morning and kind of started typing some of these things out, because I saw kind of this confluence of how I was raised and and how my brothers were raised, et cetera, and how I saw this is back in the late 60s and early 70s into the 80s, before I left for college in 82. For certainly until junior high, typically parents are kind of the biggest influence for most children until about junior high. Somewhere around 12, 13, the kids start having other kids influence them even more than potentially the parents. So the kids are not under your roof until age 18 or whatever. They're actually listening to you and kind of watching you. They watch you and listen to you all of your life, but they're listening and watching to you probably, until probably junior high, before other people start having as much, if not more, influence on them. So one of the things what I recognize is I listen to adults talking about their childhoods, about their first memories, and about the what happened at school and at home, and that's typically those are the two big fears: school and extracurricular activities, and home. Those are the big ones. Is that kids talk about stability, they talk about happiness, and I know the kids don't have the burdens of the adults that are heading the household, but there's a hierarchy, and so the kids don't have power. They don't have they can't feed themselves and clothe themselves, and they can't make their own money, can't make their own decisions oftentimes. And so they're kind of powerless. And what we find with a lot of parents, and especially with parenting, especially young parents, is that they have all sorts of tensions. And I know within 2 or 3 years, I was engaged, I was married, I had a honeymoon, I started my practice, we had 2 children, I bought a house and cars, and everything happened within a few years. Tons of financial tensions, tons of big decisions, sometimes life-changing decisions. And oftentimes both parents are working. It's not like one is working and one is able to step back and look at the bigger picture and look at the kids and see balancing everything out. So everybody's kind of running furiously in order to kind of make things happen for obligations and for needs, and sometimes for wants. The extra stuff that maybe you didn't need, but for the wants, because you've been putting off things for a while in terms of purchasing or traveling, etc. This is why it's important to have friends and family and grandparents and aunts and uncles, other people who can chip in at times whenever things are difficult and stressful. But what we see whenever it comes to pathology, whenever people come to see us and having problems with their depression, anxiety, and relationship problems, and work problems, and health problems, physical problems, is that a lot of stuff happened in their childhood that was traumatic. So they oftentimes would either have problems with attention, whether it's because of ADHD, attention deficit hyperactivity disorder, or because there was tension in the household, that there was not rules about doing homework and about going to bed and eating right, etc. There was nobody to mediate conflicts between kids, that the parents were either dismissive of the kids or had corporal punishment. There was oftentimes, many times, substance abuse or drinking. That was a part of what we end up seeing that the children lasted through. they got old enough to be able to come to see me. But this is the stuff that lasted in them decades later, that we're trying to peel back some of the layers and trying to work with them, name some of this stuff, talk about the shame, guilt, fear, anger, anxiety, depression, etc., and then work with them with our current medicines, antidepressants and medicines for anxiety and for sleep, etc. So what I recognize is that people are trying to do the best. Nobody wakes up in the morning and tries to do a bad job, whether it's the kids or the parents or anybody else. But what happens, unfortunately, is that by the end of the day, things have been in shambles. Whether it's people's behaviors, what they said, how they said it, is that they just kind of trying to get through the moment. They're looking at the immediate consequences of doing or not doing something as an adult, and what cascades is that these kids who are afraid to say stuff because they recognize how much tension there is in the household, is that these kids end up acting out in different ways. Sometimes they quietly, they internalize and they're quiet. Sometimes they do other things, drugs, alcohol, run away, misbehave, etc. So all these things for me, starting in their youth, signals something to me that's happening either in them personally or in the family or in their environment. And I'm picking on the family because it's the easiest to talk about. It's harder to control school or friends or friendships, etc. So that's but the family is what we tend to focus on over and over again. Now, certainly later in life, later in their youth, and youngsters can have problems with their friends, with their partners, boyfriends, girlfriends, teachers, authority figures, etc. But literally for the first decade plus of their life, it's really the family. And the family can be all sorts of different people. It doesn't have to be just the biological parents, but it could be aunts, uncles, foster parents, etc. The other thing that I remind people who are very good kids in terms of behaviors, but have significant problems later in life. So very good kids because their dad was drinking or mom was drinking, so they knew not to stir up trouble. Or their brother or sister had emotional or medical problems, so the family was focused financially and energy was focused on their sibling. And because my patient was well behaved, etc., they were kind of a little bit ignored or significantly ignored in a lot of ways because they were doing relatively well. Is that decades later, we see the consequences of this. My purpose is not to tell people that they can't, for adults to ignore their problems and focus on the kids. My purpose is to say, whenever you're solving your problems, whenever you recognize you have problems, whether it's drinking or finances or in-law problems or neighborhood problems, is that it's not just about the moment, but it's also how your kids will see and feel and respond and behave decades later that actually is that's being built there on the spot at the time that the parents are having difficulties and conflicts. So that's the time what I want to highlight for people is not just that their kids are having problems at the moment or the kids are doing very well at the moment, is that what we see decades later is probably linked to, if not caused by or augmented by, the stuff that's been happening in their youth. Oftentimes you say, well, what do I do about this? Thank you, but I don't have money. I don't have money for this. I don't have time for this. And this is when it comes to, and this is for me included, comes to prioritizing things. Just because there's money to be had doesn't mean that you should be having it, because it may not get you to certain goals in terms of health for yourself or health for your family. And so that's one of the first things. And a lot of this stuff goes back to finances. One of the top three issues that stressors in anybody's life, let alone if you're married and have kids, or not married and have kids but just have your children, are finances, money. So I call it money and money equivalents. Money equivalents are typically time and energy. But so that's one of the things that, so even though that's outside the purview of being an internist or being a person who gives patients ketamine for the mental health issues that they can't get better other ways, I will argue that things such as the adults, the supervising adults, the loving adults is their finances, their own mental and physical well-being. That's addiction, their diabetes, all this stuff like that matters. Not only matters for the moment for the adults, but actually matters for the kids for the moment and also decades later when we see them. So kids pick up on all sorts of things. They pick up on financial tensions. They pick up on tensions between relationships between the parents or the adults who are supervising them or taking care of them. They pick up on issues about their siblings. They pick up on all sorts of other conflicts and issues. And the ability to actually be able to talk about them, to name them, and to also get help at that moment, for the adults is a humongous deal that has compounding benefits decades later in the people that I see. So it's not that kids can't have hard times or hardships. It's that the parents recognize that they're going to be doing it together. Their parents or the adults are going to be going kind of, we're all in the boat together. We're all going to be rowing the same direction. We're going to talk about it and we're going to get help, etc. That makes a big difference. I'm not telling people not to have problems or hide your problems from your kids, but I'm saying to be able to discuss them. So, for instance, my mother, we didn't recognize her until probably until a few years after we immigrated to the United States. She had a bipolar type 1 diagnosis, so she had significant severe mental health issues. This is back in the mid to late 70s and early 80s. And so a lot of stuff that back then we did not talk about stuff like this, but back then they did not discuss anything to the kids and stuff like that. Even though I was the eldest son, I went eventually into healthcare, particularly because probably my mother and I saw the needs there for other people, but that I no adults, no parents, no mom, no dad, no physician, no nurse, or no psychologist sat down with the kids and said, hey, this is what we're seeing and this is what we believe is happening. How are you doing? That type of stuff. I'm not telling people not to have bipolar disease. That's a lot of hereditary and genetics and a lot of other things. But I'm saying that you have to include kids whenever it comes to things that are around them, whether it's in the neighborhood or under the roof that they live in. So that's kind of my best advice.
So I had a quick question.
Sure.
So as a parent or just anybody, I'm not a parent, so I'll say just as someone who's seen it before, it's kind of hard to tell the difference between a child's emotion and we'll call it, say, an adult's emotion. Like there's mental health issues that affect everybody of all ages, right?
Yeah, that's right.
But a child can act if they run out of chocolate milk the same way an adult can act if they just lost their job. So how do you differentiate between this child might have a serious problem or are they just a really upset child over something small?
So feelings and feelings. All of us have feelings about all sorts of things. They're oftentimes passing. They're oftentimes immediate and passing. If they're recurrent, it gives us hints about something, whether the environment around them seems to be triggering it or causing it or augmenting it, or the person who's expressing the feelings or emotions is having an issue with it. So anything that lasts a long time or recurs gives us a hint that maybe it needs to be paid attention to. So if a child, and this is everything from wetting the bed to anger outbursts to hitting to biting, all these things gives us a hint that there's something going on, whether it's with the child, and we already know this, with the child or in the environment. Too often we look at the child and we look at diagnose with it as oppositional or as attention deficit or as addicted or whatever. And oftentimes I will tell you it is the environment and the family and the environment that the person is in, the youngster's in, that's the major issue. That what we're seeing, what the tip of the iceberg that we actually see that sticks above the water is the kid's behavior or lack of behavior. They can't make it to school on time. They can't turn on their homework and stuff like that. Absolutely. You need to address and make sure that they don't have attention deficit. They don't have vision problems or hearing problems or sensory perception problems. So all these things matter. But I'm going to tell you over and over again is that the family life, the environmental life, the neighborhood, the social situation, the financial situation is a big contributor, or if not the main contributor, but it's a big contributor. So it's oftentimes, like you said, it's hard to know what the chicken and the egg is, what the primary move is. Is it because dad comes home late at night and slams the door and everybody's quiet or crying and there's yelling and stuff like that and the kid can't get their homework done and that's why they're having problems in school the next day in terms of they're too tired and they haven't turned in their homework because they couldn't go to sleep because of yelling, because nobody's supervising for the homework? Or is it because they have ADD and ADHD and they stay up all night gaming, all stuff like that? So you're absolutely right. There's a big difference, and that's where it becomes an investigation to figuring out what's happening, when it started. Does it affect more than one area? Is it just this one class with this one teacher with this one subject, and you're fine everywhere else, or is it a diffuse problem that's multiple spheres of the youngster's life? So once again, there's no blame here. Nobody's going to come in and take over take over the family and to run it. So the idea is that people need a lot more insight and eventually a lot more help in order to kind of figure some of these things out. I certainly did not grow up with all the tools that I needed to do well in college and to do well later in life. I grew up in a family, and I went to med school, and my brothers went to engineering school, and so we were bright, but we certainly did not have all the tools that we needed from our environment and stuff like that in order to develop. Nobody does technically, because you grow, and when you grow you learn, and part of the learning is learning how to get along with roommates, learning how to pay bills. All that stuff is partly developmental that you may not do at home, or not do much of it at home, or may not see much of it at home, and we go from there. By the way, I'm making certain assumptions that people have some sort of stability, some sort of home. Some of our kids are homeless. Some of our kids are not getting fed, and they still come to public schools. So I think
there's some times where it's like kind of obvious what the problem might be.
Absolutely. Some of the stuff is so obvious. They're couch surfing. Nobody in the household will help them with their homework. Nobody communicates with the teacher. Nobody's
abandonment
involved.
Issues.
Right. Absolutely.
You'll see that.
Absolutely.
I have a ton of friends. Not a ton, but I do have quite a few friends that dad wasn't around.
Yes.
And you could see that throughout their life.
That's right.
Like you could see
Absolutely.
The way they'd act about just any situation.
And then we wonder why the healthcare system is so expensive and doesn't do well, and nobody's available to you whenever you want to see a therapist or a psychiatrist. It's, they're not on your insurance plan, or they only take cash, they'll see you, and it'll be in 3 to 6 months whenever you need help yesterday. So, but the stuff that we're seeing started, maybe not was full blown, but started decades ago. And like I would argue, it would start the first few years of life. So that's, if we, in order not to enter the medical system because of mental health and physical health too early, a lot of it starts from the psychosocioeconomic issues that we see in youngsters. So psychological stuff themselves, socioeconomic stuff, and we know that there's socioeconomic determinants of health for physical health, everything from your heart to your mental health to diabetes. We can do it by zip code because of how people are segregated by income levels. So there's a lot of stuff that can be done well before you ever see a doctor, well before you need an MD or a DO or a nurse practitioner and stuff like that.
It's crazy how the socioeconomic impact can have on such a young child, like when they start to actually understand that kind of thing. Because I remember when I was a kid, as you'd get older, and we were by no means starving or anything like that. My parents worked. We had what we needed. But it became obvious over the years, like, oh, hey, some of my friends, they just have a lot more.
That's right.
They just have, more
they
financials.
Go on vacation, they have nicer clothes. They go on vacations.
Bigger house. There's little, everything's a little nicer.
Nicer.
It affects children.
That's right.
They feel like they're being judged.
That's correct. And so eventually, you're correct. Eventually, you'll recognize that one of our, as they say, one of our problems in terms of our sadness or anxieties is that we're judging. We compare ourselves. Compare ourselves to others, and that's what makes us unhappy. That's part of it. But also, comparison is important for people to say, wait a minute, they're able to talk to their kid who did something wrong, and nobody blew up, nobody hit anybody, nothing was thrown, nobody was left out, locked out of the house, so it's so weird sometimes, and that's when you do compare yourself and you say, wow, it's so dramatically better or worse. I mean, sometimes you're like, oh my God, they're so much dramatically worse than my family is. But the judgments, my purpose is not to make judgments. My purpose is people are trying to survive, both the kids. And that's how they become dysfunctional later in life. I'll talk about that in a second. But also the adults. The adults have only certain tools, a certain amount of hours per day to work, to provide, et cetera. So one of the things that I tell people in their 30s, 40s, 50s, 60s, 70s, and 80s, whenever they come see us for ketamine and for the treatment-resistant depression and trauma, treatment-resistant trauma, is that the way they behaved, the way they perceived the world, and the way they behaved or didn't behave saved them back then. So if your mom was throwing a fit around the dinner table, you just quietly went to your room and you hid and stuff like that. Didn't speak your mind, just speak your piece, didn't tell anybody about anything of your problems. But later in life, 20 years later, when you try to have a partner, you don't speak and you don't want to complain or you don't do anything, then it becomes an issue in terms of communication. But that was kind of learned. It saved you back then, so you didn't get hurt by your mother. But decades later, you're having a problem with your relationships because the same behaviors is now dysfunctional. Back then, it saved you. Now it's a different context. And in order to try to get along with people and work and stuff, you have to talk talk your piece in certain way, in certain socially accepted ways. So this is kind of what I talk about to patients. I never blame their parents or their family or upbringing. I just point out this is potentially where it started or where it was exacerbated, and now we're going to have to unwind some of it's not just the mental piece. The mental piece being the thoughts and the feelings and the memories, but the neurologic circuitry, and that's why we do. Cognitive restructuring, we do memory reconsolidation. All these things are kind of words to kind of mean that we're trying to kind of help rewire the brain in terms that they're no longer in danger, they're no longer a kid, they're no longer have to be. They can use their words instead of their fists in order to express themselves. All these things that we have to kind of help people unlearn is what we end up spending tons of time with. We believe ketamine helps with neuroplasticity, the ability to kind of help people make new neuronal connections, hopefully healthier, better, more functional rather than dysfunctional connections. And there's other things for trauma recovery where we do EMDR, the eye movement desensitization, reprogramming, all these techniques to help people kind of rewire themselves so that they're don't behave like they used to, or don't feel less so, and don't behave as dysfunctionally now that they're an adult and in a totally different situation. Yeah.
Okay, what about schooling? Because you got like your homeschooling, your
Sure.
private schools, your public schools.
Sure.
Have you seen a difference in patients based on their background as far as
In terms of the behaviors, or in terms of the depression and stuff like that?
Yeah.
Or?
Everything.
Yeah. So obviously, well, not obviously, but I mean, there's a big difference. There's some homeschooling that's fabulous compared to the public schools that the youngster may be going to. Some parents are very attentive. They're part of a system. They have a whole game plan, and there's a lot of discipline behind doing the homeschooling. And they have the parents are educated in how to educate. It's not enough to be educated yourself. You have to be able to teach or to be able to guide the student in their learning. So absolutely, some people are way ahead of the public schools in terms of their knowledge and certain things. A lot of times, homeschooling is not as effective as going to a public school or private school, and the same by versa. Sometimes public school is not as effective as private school, et cetera. And that's where we rely on the parents and some of the teachers that get to know the youngsters to kind of be able to pick and choose between this teacher, this class, or this school, this area, stuff like that. It makes a difference. It really makes an enormous difference in some kids, just because they're the legacy. Everybody went to this private school in their family may not work very well for your youngster, and it's hard. It's a hard pill to swallow whenever your youngster is different than the last 2 or 3 generations of people that went to this school. So that's important to kind of focus on what the youngster, how the youngster behaves, what the youngster needs, how the youngster learns, et cetera. And I saw that when my kids went to colleges that were different than mine, and I would not have picked it for them, but they flourished because they knew themselves, and they picked appropriate schools where they really flourished for college instance. So even then, this is only 10, 15, 12 years ago that my kids were doing, 15 years ago that they're doing this. And that, so I have to say that my kids had better insight about themselves than even I did in terms of how they learned and what they needed in order to flourish. Yeah.
Well, I think you've done a great job as a parent.
Yeah, it's reasonable.
I've met one
okay.
of your daughters. She seems pretty squared away.
She's all right. We like our kids. We like our kids, which is a big. I think that's a thank God for their mother. So that's as I say. But anyway, no blame. I just want people to understand that that a lot of stuff that we see as an adulthood for these youngsters, where we see them later in adulthood, because we only take care of 15 years on up, and most of our patients are older than 15. Has his roots. Some of the difficulties have the roots way back in childhood, and most of the first probably 10 plus years of childhood is a lot of home-based stuff. Some of it's school, but a lot of it's home-based things. So I encourage the guardians, the parents, to kind of look and ask themselves, how is the stuff that we're going through, the positive and the negative, how is that affecting our youngster now and potentially for the future? By the way, I grew up with corporal punishment. I became a doctor despite it, not because of it. I believe I would have still become a good doctor without it. I learned this we never did that. We never threatened it for our kids and stuff like that, and they turned out okay. But it takes a lot of energy and focus and time in order to regulate yourself as an adult, in order to watch your kids, in order to catch things when they're small, before they kind of get big and loud and expensive. So it's important, and that's once again that's checking yourself as an adult about what your purpose is, what your goals are, your financial needs. All these things make a difference in terms of how irritable you are, etc. I will argue that no matter what your socioeconomic status is, you never have to hit your kid, for anything. You may, if they're running out in front of the car, you may yell and snatch them, but that's not the same thing as walloping them. So I will argue, and I would not have, if you asked me, 35, 40 years ago, whenever I was a youngster, if you would have to, and I answer, I would have said, yep, I grew up that way, and that was good for me and stuff like that. But it's probably been 25 years or so that I have to say, no, you probably don't ever need for corporal punishment for a child. Just like if you look at my blog.
Yeah, and you got a lot of people nowadays that say, like, when you see people in their 20s or something like, oh, look, they act like spoiled little kids because there's no disciplinary action anymore, and they grow up and they think that they're...
Discipline doesn't... Discipuli in Latin means student. So you teach. So there's a teaching and a student, or a teacher and a student role. It is not... discipline is not corporal punishment. So I know people say it includes it, and certainly it's a quick and snap way to get things done, but it doesn't last for very long and has long-lasting effects that are very, very negative. And as soon as you turn your back, the kid's doing it behind your back, and they're afraid of you. So that's, you want to be, feared or respected. Somebody says both. I will argue the word fear for me means respected, but it's not because people are afraid of me. It's because because I'm a good person deep down inside. Once again, a lot of this stuff comes to the purpose of the parents and how they use their time and their energy and their goals. And that's very hard to do whenever all you have to do is just get up in the morning, go to work and come back and eat and do a couple of things and go to bed and repeat tomorrow. It's not the same. That you have to step back and actually look at what you're doing and how you're doing it. And if that's going to be good for your own health as an adult, your own mental and physical health, and how it's affecting the people around you that you care about. Yeah.
Okay, well, you can read this blog, and listen to past shows as well, and listen
and get on emails and other ways and yell at me.
Yes, and you can contact us as well. It's all at notyourdoc.com, and the email is notyourdocpod@gmail.com. Doctor, thanks so much for sharing your insight. Obviously, my parents did a great job. You cannot argue with these results here.
That's right. And this is, and yes, and it's always, I'm always fascinated. I remind people they're all survivors, even if they've had horrific things. If they come see me at age 50, they're survivors, and it's something to be complimented. Yeah.
Awesome. Well, thank you so much, Doc, and we'll have. This has been a good talk.
All right. Thanks, Seth.
All right. Thank you.
Bye now. This previous podcast represents my opinions and the opinions of my guests. This is not medical advice, and I'm not establishing a physician-patient relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each patient is so unique, please consult your healthcare professional for any medical questions that you may have.